Just thinking about all of these factors, it brings to mind the use of things like artificial intelligence and machine learning, especially when we talk about gaining this more holistic idea of how the human body works and how all of the factors
Yes.
individually. Do you have any thoughts on how these different fields might come together and maybe through machine learning kind of find some insights? Any thoughts on that?
Yeah, no, we are all excited about the opportunities that we will have with AI and machine learning. Um, uh, a key factor when you think about AI and machine learning is that you need to have data to feed the machine, right? And so what we realize is that we really don't capture a lot of these informations in our medical records. Of course, we do capture the sex, maybe obesity, yeah, in terms of weight, but we don't capture like what the patient is eating. We don't capture necessary inflammation. We don't capture if the patient is doing exercise. And so I think one of the conclusion after this session, I think at least I had, and I think many people had too, is that we need to start to capture those factors as well. So we're gonna be able to feed them to the system, to the AI system, together with all the lab values, etc., so that we can really look at the patient with a holistic view, as you mentioned. I think this is one of the exciting part about the session. So I'm thinking, for example, about questionnaire about what they eat, actually trying to measure the exercise. I don't know, smartwatches, for example, right? This type of thing can really be helpful in recording their habits.
Mhm. Yeah, it makes me think about how wearables, for example, like you mentioned, are gonna kind of play a factor in what that means for how we talk about patient data, maybe in the future in general.
Absolutely, I couldn't agree more. I think that there are already wearables that are being evaluated in our field, for example, to monitor for toxicities, cytokine release syndrome, neurotoxicity, and so on. I think those same wearables or similar ones can be used to capture um, exercise, even sleep habits, for example. And interestingly, there are now apps that you can use to take a picture of what you eat and can actually potentially quantify the calories, the amount of food that you're getting. So imagine if we were able to integrate that, I don't know, in a single app or in, putting all the data together. I think it would be very, very powerful.
Fascinating.